Hello and welcome to A New You in Wellness Telehealth Psychiatric Services. My name is Diane Costa and I'm a psychiatric mental health nurse practitioner here today to talk to you about mental health disorders in an effort to help reduce the social stigma and help to provide some insight in order for you to understand the importance of mental health care. We live in a society that provides us with maximum material wealth, political and economic freedoms, and the opportunities for success. Meanwhile, stress, anxiety, unhappiness, and depression have reached an all-time high. The Center for Disease Control statistics acknowledge that in our society, 20% of individuals are affected by a mental health disorder. That equates to 1 out of every 5 individuals having a mental health disorder. So rather than dodge the idea of discussion and whether or not you or someone you know has a mental health disorder, today I would like to share information with you about the number 1 mental health disorder in our society, which is depression. Then you can decide with this information whether or not you or someone you know is in need of mental health care. Depression is a situation that I think we've all experienced. We've all experienced moments of sadness, maybe not wanting to get out of bed in the morning, not wanting to face things that we need to face for the day, but that in itself isn't actually depression. Those are thoughts, feelings, and behaviors that are very temporary. Clinical depression is more than just a culmination of those symptoms we mentioned with depressive syndrome. Clinical depression involves having a minimum of 5 out of the 7 following symptoms. These symptoms will last a minimum of 2 weeks and as much as up to 6 months. But the primary difference is these symptoms interfere with the person's ability to function in everyday living. Symptoms include things like sleep disturbance. This could mean a person is either unable to sleep a full night, not able to fall asleep at all, or wakes up super early in the morning and can't fall back to sleep. Sometimes a sleep disturbance can be the opposite, something we call hypersomnia, where a person is sleeping so much that they don't feel like they can get enough rest. Interests in the things that we normally would enjoy are all of a sudden unenjoyable. That's another common symptom of clinical depression, an inability to find happiness and joy. Sometimes guilt, shame, and feeling as if you're not good enough or just not enough of the world, and can sometimes feel like a burden on yourself or other people who care about you, is another symptom. Energy can be affected, where you're feeling quite fatigued. Emotionally, you're fatigued, physically, you're fatigued, and no matter how much rest you get, you just don't feel like you have the motivation to be able to do the things that you would normally do. Concentration can be affected. Concentration in the form of feeling disorganized, forgetful, unable to just complete those tasks with ease that you could once complete. Appetite changes can also occur. This can be an instance where you have no appetite at all, or all of a sudden you're ravenous and you're just eating way more than you normally would eat. And that can be very uncomfortable. Psychomotor changes that occur are things like feeling jittery. Have you ever found yourself to be so anxious that you can't sit still? Maybe you're shaking your leg or tapping your pencil or just doing things where you just feel unrestful and restless. That can be a symptom, or the opposite, where you're moving very, very slowly, much more slowly than you normally would be moving. And that is a psychomotor type of symptom. The last symptom, which is so important to recognize, is suicidal thoughts. In fact, people can have suicidal thoughts thinking that maybe they're better off not being in this world. Maybe everyone else will be better off if they're not in this world. Clearly, if you have any of these symptoms, it is important for you to be able to find someone that you feel comfortable with in order to share these symptoms with them, so that you or someone you know can access mental health care. There is no definitive cause or reason that is understood why depression lasts as long as it does. What we do know is some of the commonalities as to why clinical depression occurs. It could be a result of chemical imbalances in the brain, or perhaps a traumatic event in someone's past. It could also be due to drugs and alcohol, and in some cases it could be due to a medical condition. The good news is, clinical depression is treatable. It can be treated with a combination of medicine and therapy, and sometimes there are physical treatments that can take place. Those are for the extreme cases where symptoms aren't managed with therapy and medicines. If you or someone you know may have these symptoms of depression, and you feel as though they may be in need of mental health care, please feel free to reach out to someone that you feel safe with in order to share your thoughts, your concerns, and your behaviors. If you're not sure who to reach out to, I recommend that you try going to your primary care physician or your nearest mental health center. Please remember that clinical depression, it's not an option, it's a condition. And just because you can't see it doesn't mean it isn't real. Thank you, and I look forward to sharing mental health discussions with you in the future as part of the primary campaign for World Health Organizations, making mental health care a reality for all.